All right, y'all, welcome back to Level the Playing Field. I'm Dr. Owusu-Akyaw. Today I'm going to give you an inside scoop on the operating room where surgery goes down and talk about what happens in there and who all is in there. So please like and subscribe for more content related to this. Let's get into it. So I'm an orthopedic surgeon. About half of my week is spent performing surgery on those who need it. And my specialization is sports surgery. Right, so I do, a lot of ACL surgery. I do a lot of arthroscopic surgery of the hip and the shoulder, and frequently these are sports injuries, although they can happen to anyone. And so the operating room is kind of a black box for a lot of people, and understandably so. Very few people have been in the operating room unless you work there, right? And so I find a lot of patients have questions about it, and I think it makes sense for us to break down what is even going on there, what's the expected day of surgery, who's involved with my care, who's going to be helping me out. So to start off, right, let's say that you unfortunately are in a situation where you need surgery. Now, if that happened to you, you would have met with your doctor, your surgeon ahead of time in the office, in the clinic, and y'all would have talked extensively. You should, make sure you feel comfortable with that surgeon, feel like that's somebody who I could work with. You should have done your research and read any information about the surgery that's going to happen, so you're coming in informed. You all have kind of talked it through, and we go through a process called informed consent. Now, what does that mean? Well, we talk about what procedure we're going to perform. Again, if maybe it's an ACL surgery, then we're going to talk about all the details about ACL surgery. What's our plan? How are we going to reconstruct it or rebuild it if we need to? What are the risks related to surgery? These are things you and your surgeon should have talked about in detail. Once you've talked that out and you feel comfortable with that, we'll have you do what's called an informed consent. You're basically going to sign a permission slip saying, I agree to have this surgery done. And that happens, before any surgery is done, of course, okay? So that discussion is very important. Informed consent is the key to making sure that you're involved in your care. You understand everything that's happening. You understand why it's happening. You understand when things could go wrong. You understand what's going to happen after the surgery. You got to have that information. Right? And so on the day of surgery, you're going to meet one of the team members in addition to your surgeon, the anesthesiologist. Now, the anesthesiologist is the doctor in charge of putting you to sleep for the surgery. For most surgeries, you're going to be asleep in some sense. How deep you're going to be asleep depends on the surgery, right? But for most surgeries, you're going to be asleep to some sense. And so the anesthesiologist is really in charge of making sure you're safe during that process of going to sleep, and staying asleep for that surgery. Anesthesiologists frequently work with nurses who also specialize in anesthesia. Those nurses are called CRNAs, and they are critical to keeping you safe during the surgery. A lot of times, the anesthesiologist and a CRNA, a specialized anesthesia nurse, are working hand in hand together, right? And they're a team keeping you asleep during a surgery. So you'll meet those individuals, they'll talk to you about their process, about going to sleep for surgery, which is really, it's part of the surgery process, but almost a separate thing from what the surgeon is doing. So they'll actually talk you through that and have you sign a permission slip to do that as well, the anesthesia consent. So when that's been kind of taken care of, usually you as the patient will go off to the operating room. We'll let you talk to your loved ones, to your family members who are there with you. We'll say goodbye, we'll have them go to the waiting room, and then you'll go off to the surgical room. When you get to the surgery room, or the operating theater is a technical term, when you get there, you're gonna meet the rest of the team, okay? So as a surgeon, I only have two hands. I can't do the whole thing by myself. There are people who need to help me throughout the surgery. And so you'll meet those people, although you may not remember all of it, but those people are there to help the surgery happen safely, right? So in a surgical room, right, there's an area called the sterile area, and that's where all the instruments that are going to be involved with the surgery are. That sterile area, as you might imagine, cannot be touched with hands that are not sterilized, right? So wearing specialized sterilized gloves, that's the only time that stuff can be touched. So it's kept separate, away from anything that can be touched, so it doesn't become contaminated or touched by someone who hasn't properly cleaned their hands. In the surgical room, you'll meet what's called the circulator nurse. The circulator nurse is really in charge of running the show, okay? So when I'm in surgery, I have my special gown and my special gloves on, so I can only touch the area where I'm doing surgery and the specialized sterile instruments we talked about. So let's say we need to go grab something from outside the room to help get things done, or we need to do something mundane like change the temperature in the room, right? I can't do that. My hands are sterile, I can't touch the thermostat, right? The circulator nurse can help us with things like that. The circulator nurse is really in charge of the manager of the room in terms of making sure all the equipment is there, making sure it's ready to go, making sure it's safe, and really they're keeping an eye on the whole situation. So that's, I mean, even more so than me, the circulator nurse is like the quarterback in terms of the room. Involved in the actual sterile part, the actual performing the surgery itself, right? We have people who are helping me do my job. Like I said, I only have 2 hands, right? I only have 2 hands. So I'll have a surgical assistant. Now that surgical assistant is basically someone who's helping me to do things that I can't do with my 2, without having more hands, right? They're my next set of hands. They help me, you know, if I'm doing a surgery on a knee, I need the knee held a certain position for me to do the work. They're helping me hold that knee where it needs to be, right? If I need them to maybe hand me an instrument, they'll do that too. Now there's somebody else in there who's more so handing me the instruments. When you're watching like Grey's Anatomy, right? You see a doctor put their hand out and say, you know, hand me a scalpel, and then they put a scalpel in their hand, right? That's a surgical technician. The surgical technician is the main person handing off instruments. And so in most surgeries, there's a team of people who are sterile, who are touching, you know, doing the sterile part, touching the patient, touching the sterile instruments, the clean instruments. And those 3 people are me, the surgeon, my surgical assistant, and the surgical tech. We almost form kind of this trifecta, this team that works together. Now, sometimes, you know, for a big surgery, you might have multiple surgical assistants. Sometimes for a big surgery, you might have multiple surgeons, right? Depending on how big the surgery is and how many hands that you need. But that's really the team that you're gonna see in the operating room. So you'll have an anesthesiologist and the CRNA, the nurse anesthetist, who are really working to keep you asleep and safe during surgery. You have a circulator nurse who's really the manager, running the whole thing. You have the surgeon, him or herself, who's performing the surgery, of course. You have the surgical assistant who's there to be the surgeon's second set of hands. And you have a surgical technician, the surgical tech for short, who's handing off instruments. And oftentimes in the room, depending on what kind of surgery you have, you know, there are, just like anything else, when you're performing a surgery, the instruments are made by different companies, yeah? So different companies may send a representative into the room to make sure things are running right. Now that person never touches the patient. They kind of stand off in the corner and just there to make sure things are safe, but that person is from the company to make sure that everything that needs to be used that's from their company is working properly. Or if there's questions about how a certain instrument, you know, works, or if there's a malfunction, they're there to troubleshoot. So frequently we'll have a representative from that company there in the operating room. Now again, like that person is not a medical provider, so they're never gonna touch you as a patient. They're not anywhere near you, but they're in the room to make sure that all the technical aspects of the equipment go well. And that's very important because equipment is equipment. It's equipment just like anywhere else. Equipment malfunctions, it's no different in surgery. So having an expert for that particular equipment there to help us troubleshoot, critical, gotta have it. So the surgery ends, everything goes successfully. We fix the problem, we get you cleaned up, okay? You're taken to what's called the post-operative recovery area. Sometimes it's called the PACU as a short term. The PACU is where you kind of wake up, right? And there are nurses who are dedicated to that area to actually make sure you wake up safely. So depending on what surgery, there are certain things we want to see you do to make sure that you're safe to move on to the next step. Now, for some surgeries, that next step is to go home with your loved ones. All done, go home. That's called the outpatient surgery. For some surgeries, maybe that are bigger or more extensive, you're gonna stay in the hospital for a day, maybe 2, right? That's an inpatient surgery. But for you to leave the post-operative area, that PACU, there's really a checklist that these nurses are looking at to say that, okay, you hit all these checklists and you're safe to go. So some examples of that are, can you go to the bathroom by yourself, right? Do you know how to use crutches appropriately if crutches are part of your recovery? Can you eat and keep something down without throwing up? Because remember, anesthesia, the medicine from anesthesia makes some people nauseous, right? And we don't want to send you out and send you home if you can't eat, right? So can you eat and drink a little something? Maybe some crackers, some ginger ale, we check that out. Is your pain adequately, controlled? Now, surgery is involved with pain. There's usually pain with surgery. Now we want the medicine to take the edge off of it, right? To make it manageable, but we can't make it perfect, but we want to make the pain manageable. So is your pain manageable for you to be able to go home or to the next step and be able to handle it, all right? And then have you adequately been educated on the post-operative instructions. Every surgery has things we want you to do or not do afterwards, and we usually give you a printout of some sort to kind of review that. And we make sure we talk to you and your loved one through that before you leave to make sure that you really have that down. Now, of course, you can call with questions, you can contact your doctor with questions, but the idea is to make sure you're adequately informed to keep you safe when you leave. So that's kind of the timeline of how it goes from surgery, and that's who's involved, right? So you almost think about it in phases. There's the pre-op area, the pre-op phase before surgery. That's when you're kind of asking your final questions to your doctor. That's when you're looking over the permission slips to make sure everything makes sense to you, right? That's when you're meeting the anesthesiologist and your team. Then there's the actual operative time when you're in the surgery, and again, that's where the anesthesiologist and the nurse anesthetist, or the CRNA, are keeping you asleep safely. And the team in the surgery, the circulator nurse, the scrub tech, the surgeon, of course, and the surgeon's assistant are all working together to get your surgery done. Then there's the third phase, the post-operative recovery, where you go and the nurses make sure that you're safe for the next step, be that going home or going into the hospital, depending on your situation. So I hope that basic overview gives you an idea of what surgery looks like and what the timeline is like, because I know it can be confusing, kind of a black box for those who haven't really experienced it. So please continue to like and subscribe to get more information and content just like this, and we'll see you next time.